Sildenafil is a phosphodiesterase inhibitor used for the treatment of erectile dysfunction. In this video, let's found. What is sildenafil? What is sildenafil used for? Contraindication. What are the side effects of taking sildenafil? How does sildenafil work? How to use sildenafil? What is sildenafil? Sildenafil, sold under the brand name Viagra, among others, is a medication used to treat erectile dysfunction and pulmonary arterial hypertension. It is also sometimes used off-label for the treatment of certain symptoms in secondary Raynaud's phenomenon. Pfizer originally discovered cation in 1989 while looking for a treatment for angina. It was approved for medical use in the United States and in the European Union in 1998. In 2020, it was the 183rd most commonly prescribed medication in the United States, with more than 2 million prescriptions. It is available as a generic medication. What is sildenafil used for? Sildenafil is a phosphodiesterase 5, PDE5, inhibitor that is predominantly employed for two primary indications. 1. The treatment of erectile dysfunction. 2. Treatment of pulmonary hypertension, where A. The U.S. FDA specifically indicates sildenafil for the treatment of pulmonary arterial hypertension, PAH, WHO Group I, in adults to improve exercisability and delay clinical worsening. B. The Canadian product Monograph specifically indicates sildenafil for the treatment of primary pulmonary arterial hypertension, PPH, or pulmonary hypertension secondary to connective tissue disease, CTD, in adult patients with WHO functional class 2 or 3 who have not responded to conventional therapy. C. The EMA product information specifically indicates sildenafil for the treatment of adult patients with pulmonary arterial hypertension classified WHO functional class 2 and 3 to improve exercise capacity. Contraindication. Sildenafil is contraindicated for patients known to have ever had an allergic reaction to sildenafil or any other medicine. Are taking medicines called nitrates for chest pain, angina. Have a serious heart or liver problem. Have recently had a heart attack or a heart problem. Your doctor should carefully check whether your heart can take the additional strain of having sex. Have low blood pressure, hypotension. Have a rare inherited eye disease, such as retinitis pigmentosa. Have sickle cell anemia, an abnormality of red blood cells, leukemia, cancer of blood cells, or multiple myeloma, cancer of bone marrow. Have a deformity of your penis or Peyronie's disease, curved penis. Have a stomach ulcer. Have a bleeding problem like hemophilia. Side effects. The most common adverse effects include headache, heartburn, diarrhea, nausea, flushing, feeling of warmth, nosebleeds, numbness, burning, or tingling in the arms, hands, feet, or legs, pain in muscles, back, arms, or legs. Pharmacodynamic. In vitro studies have shown that sildenafil is selective for phosphodiesterase 5, PDE5. Its effect is more potent on PDE5 than on other known phosphodiesterases. Sildenafil causes mild and transient decreases in systemic blood pressure which, in the majority of cases, do not translate into clinical effects. The postulated mechanism for this change in color discrimination is related to inhibition of PDE6, which is involved in the phototransduction cascade of the retina. Mechanism of action. Sildenafil is an oral therapy for erectile dysfunction. In the natural setting, i.e. with sexual stimulation, it restores impaired erectile function by increasing blood flow to the penis. The physiological mechanism responsible for the erection of the penis involves the release of nitric oxide, NO, in the corpus cavernosum during sexual stimulation. Nitric oxide then activates the enzyme guanylate cyclase, which results in increased levels of cyclic guanosine monophosphate, cGMP, producing smooth muscle relaxation in the corpus cavernosum and allowing inflow of blood. Sildenafil is a potent and selective inhibitor of cGMP-specific phosphodiesterase type 5, PDE5, in the corpus cavernosum, where PDE5 is responsible for degradation of cGMP. Sildenafil has a peripheral site of action on erections. Sildenafil has no direct effect on isolated human corpus cavernosum but potently enhances the relaxant effect of NO on this tissue. When the NO/cGMP pathway is activated, as occurs with sexual stimulation, inhibition of PDE5 by sildenafil results in increased corpus cavernosum levels of cGMP. Therefore, sexual stimulation is required in order for sildenafil to produce its intended beneficial pharmacological effects. Half-life. The terminal phase half-life observed for sildenafil is approximately 3 to 5 hours. Dose. Erectile dysfunction. Viagra only. Indicated for erectile dysfunction. 50 mg PO1HR before sexual activity, however, may be taken anywhere from 30 minutes to 4 hours before sexual activity. Maximum dosing free is once per day. Based on effectiveness and toleration, may increase dose to maximum of 100 mg or decrease to 25 mg, pulmonary arterial hypertension. Revatio, Licrev only. Indicated for treatment of pulmonary arterial hypertension, PAH, World Health Organization, WHO, Group I, to improve exercisability and delay clinical worsening. Revatio, PO, Licrev, 20 mg PO TID, may titrate up to 80 mg TID, if required, based on symptoms and tolerability. Revatio, for 10 mg 4 bolus TID. 10 mg 4, predicted to provide pharmacologic effect equivalent to 10 mg oral dose. Do not exceed recommended PO/4 dose. Safety advice. Pregnancy category for this drug is B and pharmacokinetic data suggest 25 to 50 mg of sildenafil administered orally as the initial dose for most patients. A large increase in circulating plasma volume during pregnancy may alter sildenafil pharmacokinetics. That's all the information about sildenafil we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.